Welcome, everybody. We're really excited to have you all join us here today for our conference welcome and overview. We'll have a brief introduction by Dr. Alison Kemp, who will talk to us about the Adult and Child Center for Outcomes Research and Delivery Science. And then I'll give a quick conference overview. So with that, I'm going to turn it over to Dr. Kemp, and then I will take over from there. Thank you.
Thank you very much. It's great to be here with you. Can you all hear me? This is so great to be in a hybrid environment where I can actually look out and see people. That's great. So my name is Alison Kemp. I'm the director of the Accords program. And it is my honor to welcome you here today to the third International Copper Conference, Disseminating, Scaling, and Sustaining Pragmatic Research. There is so much to cover in the next 3 days, and Bethany's going to go through the schedule with you. But I wanted to briefly introduce you to Accords because it's a rather unique program nationally. And many of the people who are attending the conference might benefit a great deal from coming to Accords and getting help, especially those who are on site in the School of Medicine. The educational core at Accords is one of the sponsors of this conference, and many of the people you will hear in the next 3 days are affiliated with Accords. So Accords stands for the Adult and Child Center for Outcomes Research and Delivery Science. And it, as a program, was founded in 2014. It is funded jointly from the School of Medicine and Children's Hospital of Colorado. It focuses on research across the entire life spectrum, hence the adult and child, and exclusively on T3, T4 science, which is everything to the right of clinical trials, efficacy trials, for example, pragmatic effectiveness trials, and population-based studies, community-based studies, essentially pragmatic science in real world settings. So why is real world science so important? I think I probably need to tell many of you in this audience. Many of you have seen a diagram like this or this diagram, estimating that it takes approximately 17 years for 14% of research to translate into practice. Most of what we discover in science is never translated into practice. It's either irrelevant to practice or it can't be implemented effectively, efficiently, et cetera. So it really behooves us to start looking at things in real world settings so that we're not wasting time and money. So Accords provides a rather unique, highly collaborative environment where professionals with different types of training can focus on solving critical real world problems. We're a centralized resource for T3, T4 investigators to catalyze innovative ideas, to get consultation, to help with proposal development for grants, and as well, we provide pre and post support for these grants. A major focus of the Accords program is mentorship training and support for junior faculty in the School of Medicine. We have fellowship training programs in both primary care and subspecialty care, as well as a K-12, an HLBI K-12, focusing on dissemination implementation science. We are organized into strong methodologic cores and programs led by national experts. And this allows us to concentrate the expertise in these methodologic areas to provide the type of support that gives career development awards a very good chance of being funded, as well as other grants. So I want to point out a few of the most important ones. We have a biostats and analysis core that focuses specifically on T3, T4 science, an economic analysis, mobile health and informatics, practice-based research networks, and a large qualitative mixed methods core that you're going to hear from, I think, in the next 3 days. There's the Colorado Program for Patient-Centered Decisions, a program focusing on community engagement and outreach, a large dissemination implementation science program. You'll hear from many people in the DNI program, the education program, and training and mentorship program. Just to give you an idea of the scope of the Accords Center, we help about 65 research investigators submit over 100 grant proposals each year. We have a 35 to 40% success rate for federal grants. We support over 50 junior faculty members with career development awards, generally 2 to 3 programs or cores providing mentorship. And we provide 350 consultation to faculty across 25 different campus departments and divisions each year. So if you are on site and you are a faculty member doing T3, T4 science, we hope you will visit us and get support. And here's the link for our University of Colorado faculty. However, no matter where you're from, you can certainly benefit from the Dni Science Graduate Implementation Program. This is a 12 credit hour program, often completed over about 24 months, and it's all online. So it can be matriculated by anybody nationally. We also have a primary care research fellowship that is open to candidates nationally. And we have a lot of recorded information from our educational conferences. Accords offers over 12 campus seminars and workshops yearly with approximately 700 attendees, and most of these are put online and are available to a national audience. So with that, I'm going to stop and turn this over to Bethany. Welcome.
All right. Thank you, Ali. We are so lucky to be affiliated with Accords as well as with the Colorado Clinical and Translational Sciences Institute as hosts for this conference. We're also supported by an R13 conference grant from the Agency for Healthcare Research and Quality. This is a 3-year conference series that is focused on methods for pragmatic research in health and healthcare contexts. It bridges multiple disciplines, including health services research, public health research, dissemination and implementation science, biostatistics, data science, informatics, and quality improvement. We have traditionally had a pragmatic research methods learning community. We create interactive tools for planning and conducting pragmatic research. And as I mentioned, we have support from the AHRQ and CCTSI and Accords. This is our 3rd annual conference in 2020. Our conference focused on planning for real-world impact. In 2021, our conference theme was implementation and conduct of pragmatic research. We've also been developing pragmatic research tools. You can access all of these archives through the Learning Times website. And over the course of the next year, we'll be packaging up all of these archives, including this year's conference, so that you can reference back to this content whenever you might need it throughout the planning, conduct, or dissemination of your pragmatic research. Ali already talked about Accords seminar series. This year, we did a qualitative and mixed methods research seminar series. We had a learning health systems seminar series, and we have our quarterly community engagement forum. In the past, we've also had cost and sustainability seminar series, as well as a number of others. The CCTSI Dissemination and Implementation Core Speaker Series includes a number of archives related to the engagement of communities around dissemination of scientific evidence. CopperCon uses an evidence lifecycle approach to plan our conferences. Phase 1 was planning, Phase 2 was conduct and implementation, and this year we focus on Phase 3 and Phase 4, dissemination, scale-up, sustainability, and de-implementation. Pragmatic research in health refers to research conducted in real-world health and healthcare settings. This involves the use of existing personnel to deliver interventions in programs, as opposed to clinical research staff. People are offered and receive care through existing workflows and processes. The products of research are designed and tested in the context of intended use, and outcomes measures reflect outcomes that matter to those who will ultimately stand to benefit, and those who will make decisions about adoption, implementation, and sustainment of our evidence. Most of you have already accessed the Learning Times platform, which you can use to join live Zoom sessions. Also, we do have, I don't know, looks like about 20 people here in person, which is very exciting. We hope that more will join us throughout the next couple days. On the Learning Times platform, you're able to download the conference program and/or individual session handouts through each session's links. And the posters are also available on the website, and you can join us for live themed poster walks. We have some fantastic posters planned for this year. Our Best of CopperCon session is on day 2 and focuses on designing for impact to achieve health equity. And then we have 4 poster themed sessions on day 3 on value, cost, and sustainability, implementation frameworks and outcomes, engagement and equity, and pragmatic trial pilots and designs. For this year's conference, we have 2 tracks. One is on dissemination implementation strategies, so a more practical approach, and one is on pragmatic methods and measures. So if you're seeking to design research to measure outcomes related to dissemination, scale up, and sustainability, that will be the track for you. We also have a number of patient and community partners who are able to join this conference for free. And if you have others that you would like to join, please feel free. You can still invite them to attend over the next couple of days. Just let us know. For the Dni Strategies track, you will learn about dissemination plans, designing for dissemination and sustainability, which has a focus on stakeholder and community engagement, participatory modeling, de-implementation strategies, and sustainability and scale-up systems, infrastructure, and equity considerations. In the pragmatic methods and measures track, you can learn about assessing impact on outcomes that matter to key stakeholders, impact frameworks, including the translational sciences benefits model and the RE-AIM framework. You can learn about system science, including modeling and simulations, and pragmatic measures of sustainability and scale-up. We hope you engage with us on Twitter. Please use @CopperCon and Copper22 as your hashtag if you want to tweet about the conference. There's also a discussion forum on the conference website. You can chat in the interactive sessions. Even if you're in the room, you can join the Zoom links, just don't connect to your audio, and you can participate in chat. Please also look for your post-conference evaluation coming soon. And if you get lost, you can email copper@learningtimes.com, or if you're here in the room and aren't sure where you are, you can also come find Jordan Crawford. So any questions, comments, or suggestions before we introduce our keynote speaker this morning? Okay. Well, we're a little ahead of schedule, so I'm going to wait a few minutes in case there are people planning to join us right at 10:15 Mountain Time to introduce our keynote speaker, Dr. Doug Luke.